Continuous osteomyelitis. This condition is a result of bacterial bone infection that causes some bone destruction and abscess formation in the bone. One characteristic is the formation of the broad abscess. It is typically found in the upper tibia, and it is a type of osteomyelitis. Another characteristic of osteomyelitis is the sequestrum formation. The sequestrum is the avascular bone island that forms within the abscess. It commonly referred to as bone in bone formation. Osteomyelitis may be acute or chronic. It is usually treated with prolonged antibiotic therapy. This is an example of broad abscess. Here we'll see the sclerosis and the lytic area in the center of the cortex. The black arrow on the tomography slides through the proximal tibia or upper tibia is pointing to the broad abscess. This is an indication of the patient has known condition known as osteomyelitis or broad abscess. Another stage of osteomyelitis, the sequestrum formation seen in the left in the radius, in the ulna, in the midshaft of the ulna, and here this is a magnification view. Sequestrum formation is another indication that the patient has osteomyelitis. The arrow is pointing to a classic example of how an avascular bone island was seen within the abscess or within the bone. The second image is a magnified view of the first image, as we see. Osteomyelitis of the calcaneus. It is pointing at bone cyst, but there is sclerotic bone formation here, or sequestrum. This is called cyst within cyst due to reaction of the infection or osteomyelitis of the calcaneus. Rheumatoid arthritis is a common type of arthritis that affect the joint, muscle, tendon, ligaments, and the blood vessels. It begins as chronic inflammation of the synovial membranes that line the joints. The second tissue forms as a result of the inflammation. In this case, it causes erosion of the articular cartilage. This second tissue is the pannus. The fibrous scarring occurring followed by ankylosing or freezing of the affected. يعني يحصل ankylosing يعني fusion of the joints or loss of the normal range of movement of the small joints. It is called ankylosis. The net result is crippling deformity, which begins in the extremities and produces toward the trunk. It usually affects the small joints first, then to the large joints. Rheumatoid arthritis can replace but may still have intermittent flare-ups. It has time for activity and relapse, and this disease affects women 3 times more than men. The signs and symptoms of rheumatoid arthritis include morning stiffness, pain, and ulnar deviation of the fingers. Treatment mainly depends on the steroid to reduce the inflammation and analgesic to reduce the pain. This is a type of advanced rheumatoid arthritis. In the hand, we see the deformities seen at the metacarpophalangeal joints, SC. Demonstrates the crippling deformity results in the ulnar deviation of the fingers. Here, the rheumatoid arthritis of cervical spine. We see the pillar in between the collapsed disc, in between the cervical discs, and the severe osteoporosis due to the prolonged use of the corticosteroid. This is a case of rheumatoid arthritis with osteoporosis. The ankylosing spondylitis is chronic degenerative arthritis that usually begins in the sacroiliac joints and spread to the spine. It is characterized by osteoporosis, fusion of the sacroiliac joints with vertebral bodies. Due to its very distinct radiographic appearance, it is commonly referred to as bamboo spine. Treatment includes steroids to reduce inflammation and analgesic for pain. Ankylosing spondylitis usually occurs in the young age or juvenile. It is type of juvenile arthritis